Hey, how's it going again? Now, I'm going to a meeting at our local hospital, and this is about one of the clinics and how they operate along with the hospital to help people out. Um, so the best way to state I'm part of the patient relations board, so that we see how much money is going through the clinic, what kind of care is going to be needed for this year, as well as just our gripes on healthcare for people living with HIV/AIDS. And for this community here, we don't have that many people, so it's easy for us to go ahead and see what's going on and see, you know, where the health system is dealing with this, because there's not just problems with the disease itself, it's actually everything else, like tuberculosis, pneumonia, where people with HIV/AIDS get a different version of it. And we are trying to help ourselves, because a lot of us are or were patients with the clinic. Myself, I'm getting care from the VA, so I don't have to worry too much about the medication. It's at a low cost, so, and that's why I said I've been surviving for 13 years, and the last 2 years have been wonderful, because if Big Pharma pulls their head out of their ass, we might have a cure, so that, I'll feel happy, you know, that we can take the red ribbon and burn it. Now, as far as some of the other people dealing with cancer, we do need to start looking at how they are or are not willing to be the right to lifers. I mean, we can all yell and scream about abortion, but when is it good to really care and push and help, to then, having somebody on life support, and, they can't, express their feeling of they want to leave because it's too hard of a struggle. So it's one of those things that damns all of us because we don't know. And it should be listen to the person that is suffering through it. Because right now, we're causing all sorts of problems. Even our own soldiers, you know, these young men and now some women, are coming back with wounds that are, could have been fatal, but they were saved, but at the cost of what? Missing a limb, or, looking disfigured. But then again, we should be having, small parades for these people that, we're doing a job and this accident happened. But that's another argument, and I've already mentioned it, many times before. Now, we should be having, more awareness to our healthcare system, not just trying to get affordable health care. It should be something that it should be affordable, period. Because with cancer and all these other chronic illnesses that, you're paying thousands of dollars for, but you're not getting anywhere, what's it all for and what's it worth? And that's why I'm a little on the fence when it comes to, should we allow abortion? And then should we pull the plug on someone who's not responsive? I mean, we don't know. And that's one of the things that I just wish we would stop the stupidity on just killing, because that's what we have been seeing over the last 8 years, is too much death, whether it's here on our own soil and over there in the Middle East as well as Africa. So, sorry, this is, a little more serious, but talking about the war, you're going to get bored after a while. But there are a few people that are going to be doing a demonstration in Washington because their voice wasn't heard over the State of the Union and what Bush wanted to do with the surge. So if you can get out and give to any of the charities that are trying to help children survive with illnesses and cancer, do so. Women and breast cancer, do so. But don't forget about the last one that's still going on, and that's people with HIV/AIDS. So, sorry that this has to be a little serious, but 13 years, and so far 2 years in remission. So